Toronto Public Health is warning that the unregulated drug supply is becoming increasingly toxic, reporting 523 deaths from opioid toxicity in 2023. And health officials say these deaths could have been prevented if more supports like supervised consumption services were in place.
So right now we have approximately 10 services which are active in the city. And actually, all of these services that we currently have are all located south of Bloor. And if you look at our maps where deaths are occurring, it's actually occurring throughout the city.
City Councillor Chris Moyes is calling on the province to increase funding for more of these services after the feds recently rejected a request from Toronto health officials to decriminalize the possession of small quantities of drugs for personal use.
So we have to take a healthcare approach to this problem, not a criminal approach to this problem.
That's why Moyes is pushing for 24/7 low-barrier crisis centers,
where people can actually go and get the help that they need. As of right now, people go to the emergency, and our emergency are inundated. All of our detox beds are full in the city. Healthcare is a provincial issue, but we as a city have taken this on because the province really haven't addressed this in a holistic way.
In response, the Ontario Ministry of Health tells CityNews in part, through the Roadmap to Wellness, we have invested over $525 million since 2019 in a range of addictions, treatments, and supports, including rapid access addiction medicine clinics, youth wellness hubs, and the structured psychotherapy program. But drug toxicity is adding to the complexity of the crisis, says Toronto's Associate Medical Officer of Health.
When we send our samples to drug checking, we note there could be upwards of 10 to 15 different compounds in that drug sample. And these are other dangerous compounds such as benzodiazepines, tranquilizers, high potency opioids. In some instances, naloxone isn't enough.
TPH has issued 4 alerts so far this year, notifying individuals who use drugs about potential toxins circulating in the city. Michelle Mackey, City News.